here from genConnect, here with Shwen Gwee, who was the host and creator and brainchild, I would say, of the event that took place on Friday, the Social Health Startup Digital Bootcamp. Did I get that right this time?
Almost. It was the Social Health Startup Bootcamp.
Social Health Startup Bootcamp. And
there's a lot of digital involved, though.
A lot of digital and a lot of health involved. Can you tell us about it?
Sure. So this is the second year we've held the event here at South by Southwest. It's part of the Startup Village, which South by Southwest created for startups. The idea behind this is that there's a lot of consumer technology people here. There's a lot of innovators, a lot of technologists, a lot of futurists, but they're really focused on consumer tech startups. I wanted to show that there was actually opportunity in healthcare to start up a health tech company. And so I wanted to provide education, inspiration, and funding advice. So I brought together a bunch of people to provide exactly that at this bootcamp.
And there were some brands involved as well. Aetna hosted a discussion. There was 3 discussions in all, right?
That's correct. So Aetna was actually the sponsor for the whole boot camp for this year. And they kicked it off with a session on why now is the time to invest in health innovation and why it's so hot right now and how it's the future of healthcare.
Why?
Well, part of it is driven by the fact that healthcare is really going mainstream. Also, there's a lot of opening up of data and opening up of technology communications, and platforms now are so much easier to get into. On top of that, part of the reason we held this was to show that there's actually a lot of viable funding options for health technology startups, all the way from innovation funds from private companies to incubators to government challenges and funds as well.
So what are some of the trends that we're going to see in digital and social health?
I think one of the big things is right now there's this whole consumerization of healthcare, mainly driven by 2 things. One is mobile devices, because everybody has a mobile device and it's so easy to get a mobile health app on your phone. The other thing is the whole idea of quantified self and wearable technologies. So what you see this year, for example, at CES, the Consumer Electronics Show, is that digital health took over the first couple of days in terms of all the content that was coming out because of all these devices, whether it's Fitbit or Nike Field Band or any number of those devices that are coming out that people wear to keep track of their fitness and their calories and all those kinds of things. So I think those are some of the really big trends. Big data is another one that a lot of people are talking about, maybe a little overhyped right now, but I think the interpretation of big data, the way that healthcare can leverage big data is another trend that people are really interested in looking at. And in fact, a lot of the government challenges are centered around this opening up of anonymous data, de-identified data, so that people can use it to actually innovate in healthcare.
It's awesome what you're doing, because you are utilizing the technology out there and trying to help people utilize the technology out there to apply it to health and educate consumers. So thank you for joining us today. Thank you for your time. I know you are a busy man at South by Southwest. He's like a rock star, you guys. He's Mr. Digital Health.
No,
so.
I mean it's a passion, and I love doing it, and I always enjoy being here with you.
You're a frequent guest, actually.
Always glad to be here.
You travel all over to talk about this. We saw you at BlogHer. We saw you at Blog World, so I mean, you're all over. So.
Well, I like to get around, but I also like to spread the word about healthcare and health innovation.
Thanks, and for more videos with Shwen, you can check out genConnect.